What's good, everybody? AB Media 83 here, and today, as the title suggests, we're gonna be talking about kidney disease, battling kidney disease, and trying to get a transplant. For those of you who don't know, I have kidney disease. I've had it for about 4 years, and I've been doing dialysis for about 4 years. It is what it is, but I hope everybody's doing all right today. And today, I just kind of want to give you a brief education on kidney disease. What's involved and stuff. So I'm going to share my screen in just a little bit, and I have a couple of videos I want y'all to take a look at. Shouldn't take very long, but it's important information that you need to know about kidney disease. All right, video set up. Let's just go on and share it. Y'all have to excuse me. I just got off a dialysis treatment, so I sound a little slow and out of breath. That's the reason why. Mm. All right, share screen. Uh, which tab? Here we go. Oh, hold on, wait a minute.
Signs and symptoms of kidney disease, also known as renal disease. So in this lesson, we're going to talk about a wide variety of signs and symptoms we can see with early disease, so early kidney disease, all the way up to renal or kidney failure. So the first one I want to talk about here is urination changes. So this makes sense. If there's an issue with the kidneys, we can have urination changes. Sometimes we may see increased or decreased urine volume. So in some kidney conditions, we can see an increased urination or increased urine volume. So patients may experience more frequent trips to the washroom, so they have to urinate more frequently. And then in some more advanced stages of kidney disease, we often see decreasing urination or decreased urine volume. Some other disease states of the kidney can lead to foamy urine. So this means there may be protein in your urine. And in some cases, there may also be blood in the urine, so hematuria. The next sign that we're going to talk about here is peripheral edema. So peripheral edema looks like this. This is actually pitting edema. So if you were to actually see an individual's legs here, and you can see that there's a lot of interstitial fluid in the tissues where it's not supposed to be. And if you actually push your finger on that area and release, you can see this pitting. This is what we call pitting edema. So this is caused by fluid or volume overload. So this can ultimately be due to advanced kidney disease. So if an individual is not urinating enough volume off or not losing enough volume through their renal system, they can have volume overload, and this can lead to more volume or more fluid in their interstitial.
Yeah, just for a side note, this gentleman is correct. I got really bloated when I was ultimately diagnosed with kidney disease. I got really, really bloated, and he's absolutely correct. Let's continue.
Areas, and a lot of times we see this in the periphery, so in their lower limbs oftentimes. We can also see this with nephrotic syndrome. So nephrotic syndrome is a case of kidney disease where there's a lot of protein losses, particularly loss of albumin. So albumin is the most abundant protein in your blood that actually helps reabsorb.
What's going on, AL? Today I'm talking about kidney disease. I have, and I just want everybody to have information on it.
Interstitial fluid. So it helps reabsorb fluid from your tissues where it's not supposed to be back into the blood. But if there's loss of albumin, as we may see in nephrotic syndrome, there's not going to be enough albumin in the blood to actually help reabsorb some of this fluid that we see in some of these cases. The next sign we can see with kidney disease is hypertension, so high blood pressure. So this is again due to increased intravascular volume. So
Yep, I'm a black man in America, so yep, that's one of the reasons I got kidney disease because of my high blood pressure. It is what it is.
if an individual is not urinating enough volume off of them, they can have increased intravascular volume. So increased volume or increased fluid in their cardiovascular system. So we can see hypertension or high blood pressure. And another symptom we can see with kidney disease is dyspnea or shortness of breath. This is often, again, due to similar reasons. So again, if there's volume overload, we can see peripheral edema, hypertension, and this can even lead to increased fluid or volume within the chest cavity, so within the thorax. And the increased fluid can surround the lungs, causing issues with breathing. And we can also see some chest pain that may occur in these individuals as well. So some other signs and symptoms of kidney disease include difficulty sleeping. So difficulty sleeping because of increased toxins. So individuals may complain of either not being able to get to sleep or having issues during sleep or being very tired during the day. And this leads into the next symptom that individuals with kidney disease often have,
Yep, I did. I did have a lot of fatigue. That's for sure.
which is fatigue. So they can often be very fatigued throughout the day. There's a lot of daytime sleepiness. And again, this is due to increased toxins. So because the kidney filters out and excretes a lot of toxins, if the kidneys are not working properly, toxins can increase, leading to fatigue. And another reason why patients may be fatigued is secondary to anemia. We're going to talk about anemia as a result of kidney disease in a moment. And the fatigue may be related to what we just talked about, difficulty sleeping. So sleeping issues, increased toxins themselves can lead to fatigue. And then there's also this anemia as well. The next symptoms that an individual may experience are muscle twitching and spasms. This is often due to electrolyte imbalances. So the kidney is very important in balancing a lot of electrolytes in our body. And if there's electrolyte imbalances, this can lead to issues with muscle contractions and lead to spontaneous muscle twitching and spasms. Oftentimes we can see low calcium and high phosphate with kidney disease. So these can lead to issues with muscle spasms and twitching. And we mentioned this before, but we can also see anemia in kidney disease. So low red blood cells or low hemoglobin. And this is an anemia of chronic kidney disease. So
I never had the muscle spasms, but that's interesting to know.
again, this often occurs later in a kidney disease process, so chronic kidney disease. And this is because the kidney produces erythropoietin or EPO. And what erythropoietin does is it actually stimulates the bone marrow to produce red blood cells, so erythrocytes. And as the kidney becomes more and more damaged, it has less and less ability to produce erythropoietin. So it actually produces less and less EPO or erythropoietin, leading to less red blood cells being produced, leading to this anemia of chronic kidney disease. So this is why we see anemia in chronic kidney disease. Now, we mentioned that the kidneys are very important in excreting many toxins and in balancing electrolytes. And one of the toxins in particular is urea. So the kidneys normally filter and excrete urea. So urea is a breakdown product of protein metabolism. And when there's kidney failure, this leads to an increased urea in the blood, what we call uremia. So increased, abnormally high levels of urea in the blood. And this uremia, this increased urea in the blood in our body, can lead to several different, very important signs and symptoms that we need to recognize. One of them is uremic pericarditis. So uremia can lead to pericarditis, inflammation of the pericardium. So the uremia can cause inflammation of the layers of the pericardium, along with some other metabolic toxins as well. So we can see patients having chest pain, often positional, and maybe pleuritic as well. And uremia can also cause uremic encephalopathy. So we can see this in oftentimes more advanced kidney disease. So this encephalopathy can lead to an altered mental status,
Fortunately, I haven't had any of this, but yeah.
oftentimes delirium in these patients, and confusion as well. And related to uremic encephalopathy is asterixis. So when an individual has uremic encephalopathy, they can have this sign known as asterixis. So what is asterixis? It is actually a tremor flap at the wrist. So what a clinician will do is they will get a patient to put their arms straight out in front of them, lift their wrist like so, and get them to close their eyes. If the patient lets go of their hand or they lose control, they're not able to keep it in this position, it falls here, they will quickly bring it back up into the original position. This looks like a tremor flap. That's why this is called a tremor flap. And this is often due to an interruption of the postural pathway in the reticular formation. This occurs bilaterally, so we can see it in both hands, and it is associated with metabolic diseases. So we can see it in uremic encephalopathy, but we can also see it in liver diseases as well. And another symptom we can see in kidney disease patients is pruritus. So pruritus is an itching sensation, so very itchy, dry skin. This is again due to uremia. So uremia can cause a patient to feel very itchy most parts of their body. And this will actually lead to excoriation, so scratch marks on many parts of their body. So we can see this as a sign of kidney disease as well. And this can also be known as uremic pruritus. So itching sensation caused by increased urea in the blood. And uremia can cause some other signs and symptoms as well, including nausea and vomiting. So patients who are in an advanced stage of kidney disease are oftentimes very nauseous and don't feel very well. This is again caused by uremia. And this can lead to anorexia or weight loss. So patients can become very thin, again, caused by uremia, ultimately caused by this nausea and vomiting. So they have a very low appetite or decreased appetite. And then another important point to note is platelet dysfunction. And again, this is due to uremia. So uremia can cause platelet dysfunction. So although platelets
For the record, I've never had a loss of appetite. Thank goodness.
may look like they are in a normal level or in a normal range, they may be dysfunctional. And this can look like thrombocytopenia or a low platelet count. So patients with platelet dysfunction secondary to uremia can experience increased gingival bleeding, so increased bleeding of their gums, of their mouth, increased cutaneous bleeding. So if they cut themselves on their hand, the bleeding may be difficult to stop. Epistaxis, so a nosebleed. Petechia and purpura, so these little red and purple spots on the skin. So this is superficial bleeding within the skin. And easy bruising. So they can gently hit their arm on a surface and it can be bruised quite easily. So these are all signs of platelet dysfunction. So again, platelet dysfunction, secondary to uremia, we see gingival bleeding,
Haven't had this issue, thank God.
cutaneous bleeding, epistaxis, petechia, purpura, and easy bruising. And we can also see increased risk of excessive bleeding in cases like menstruation, during surgeries, and during and after childbirth as well. So I hope you found this lesson helpful and informative. If you did, please give it a thumbs up and consider subscribing to the channel. And if you want more information on other types of diseases and the associated signs and symptoms of those diseases, please check out my lessons on those topics. Thank you so much for watching, and I hope to see you next time.
Hello.
All right, now this next video talks about what to expect with a kidney transplant once your kidney fails.
I'm Christine Mulvey. I'm part of the team of experts at Indiana University Health caring for patients undergoing a kidney transplant. Welcome, and thank you for choosing IU Health for your procedure. In this video, I'll tell you what to expect if you are in need of a kidney transplant, including pre-transplant evaluation and the transplant procedure. Every patient will need to undergo an evaluation as part of the pre-transplant process. The evaluation includes a variety of tests to provide the transplant team with information about your overall condition. Examples of tests include
By the way, hit the Cash App. This is very valuable information. Support the show. Hit the Cash App.
cardiac testing, blood work, as well as interviews with social work and other members of the transplant team. As part of your pre-transplant evaluation, your transplant coordinator will provide education and information on transplantation, including the benefit and risk and how the national waiting list works. You also will be educated on the costs of medication after transplant and how our financial counselors will help you work through the special rules
Ooh, medication after transplant is a doozy. I'll talk about that later.
of Medicare and private insurance plans. Once your evaluation is complete, the transplant team will review your test results. Your transplant coordinator will let you know when you receive final approval for transplant. You will be listed on the UNOS, United Network of Organ Sharing, waiting list for a deceased donor kidney transplant.
It took about a year and a half to 2 years to actually get back on the list because I had some other medical problems related to the dialysis going on. But then they got me on the list, and I've been on the list for 2 years, and now I've got in.
So those of you who don't know, dialysis is a process they use to help replace your kidney function. There are two forms of dialysis. There's dialysis you can get at a center. There are multiple companies that provide this. Then there's home dialysis, which varies depending on what you choose to do.
You kidney.
If you have a living donor that has been approved to donate a kidney to you, this surgery can be scheduled in advance. For more information about this option, please contact your transplant coordinator. For deceased donor transplant, once a potential kidney match has been identified, you will be notified and called in for further testing to evaluate your current health status and to prepare you for surgery the next day. We want your kidney transplant to go as smoothly and efficiently as possible. For the best possible results, do not eat or drink something after midnight, the night before your surgery. If your doctor has told you to take any medications the morning of your surgery, only take them with a small sip of water. Follow the instructions you were given for washing with the special cleansing soap. Leave all valuables at home. Please arrive 30 minutes prior to your scheduled surgery time in order to complete registration and begin preparation for the surgery. Once you arrive at the hospital, you will be admitted to the pre-operating area. You will be asked to change into a hospital gown, and an IV will be placed in your arm in order to administer needed medications. You may be given some medication to help you relax. Your surgeon and anesthesiologist will visit you to review the plan before you go to the operating room. During the procedure, your family will be asked to wait in a family waiting room where they will be kept informed of your progress. When it is time for your surgery, a catheter will be inserted into the bladder and you will be given anesthesia. The anesthesiologist will monitor your heart rate and breathing throughout your surgery. Your surgeon will make an 8 to 10 inch incision in the lower part of your abdomen, either on the right or left side, just above the hip bone. The donor kidney is placed and the kidney blood vessels are attached to the main arteries. The ureter is attached to the bladder. In most instances, your own kidneys are left in place. Following your transplant surgery, you will be moved to the recovery room, where the nurses will monitor you closely as you wake up from anesthesia. Some people take a bit longer than others to wake up, but you can expect to be in the recovery room for about an hour or two. Your nurse will assess your pain on a scale of 1 to 10 and assist you with your pain management needs.
There is going to be some pain and soreness involved, but they're very good about making sure that you have adequate pain medication.
Once you are stable, you will be taken to the organ transplant unit, where transplant-trained nurses will care for you. Under the supervision of surgeons and pharmacists, the team will help manage your pain, monitor the function of your new kidney, and adjust the immunosuppression medication to determine the right dose for you. You can expect to stay in the hospital for 4 to 5 days following surgery. You will be taught about the medications you need to take, signs of rejection and infection, as well as ongoing preventative post-transplant care that is critical for protecting you and the gift you receive through organ donation. After you are released from the hospital, you will continue to see the transplant team for regular checkups and blood work twice each week for the first month, and then less frequently. Remember, if you have any questions about your surgery, you can ask any of our team of specialists. We encourage you to contact your kidney transplant coordinator first if you experience any problems, including infections or illnesses that could interfere with your kidney transplant.
Before I got my transplant, I just felt a lot of aches and pains. And now I don't. I feel like my normal self.
So life's good.
Good. Excellent. Excellent.
Our ultimate goal is to return you to wellness and improve your overall quality of life.
I mean, the experience here at IU is great. They make it as easy as possible.
For more information, please visit iuhealth.org/kidney transplant. Thank you for choosing Indiana University Health for your healthcare needs.
All right. That's some basic information on kidney disease. That's not all of it, but just to give you some more context, let me use that. Give you a little bit more context. You can also get a kidney from a living donor, but the catch is much like with the deceased donors, they have to be a match. And I just went through some orientation on this, and believe it or not, they actually encourage you to set up a Facebook page to talk about getting a kidney donation. At least when I'm going through IU, Indiana University, and they actually encourage you to reach out to Facebook to talk about your kidney donation, which is what I always thought was very interesting. And I am on dialysis right now. I just got off. I I go in around 12 and I get off around 4. I run for about 4 hours. They stick a needle in my arm. Speaking of which, give me just a second. So, go up here. I sound worn out just because because I just got off dialysis. Dialysis has a tendency to wear you out. All right. 2 15 and a quarter inch needles in my arm every 3 days. So those of you who are afraid of needles, I really don't feel sorry for you, because I have to see I have to see 2 needles every day straight to the arm. But yeah, and it's still better than the catheter. See, the catheter they actually put in your chest, and it leads directly to your heart. The problem with the catheter is that you don't get stuck with a needle, but the catch is it gets infected very easily. And naturally, when I had a catheter, um, got infected. It got infected, and I was in the hospital for over a week. So most dialysis checks will tell you when you after you get on dialysis, get that catheter out of your chest as soon as possible. If you ever get on dialysis, get that catheter out of your chest as soon as possible, because it can easily get infected. And how I found out it got infected is after my dialysis treatment. This is about maybe a year or two into my dialysis treatments. I kept getting a fever after treatment, Now, keep in mind, I haven't didn't in uh full context. This is before COVID. I hadn't had a fever in almost 20 years, but I kept getting a fever after treatment. So one day I forgot to take some medicine in the morning, so I went home to take my medicine and threw up like I had food poisoning. So after that, I went to the hospital, and I was in the hospital for over a week. The hospital couldn't figure out what was wrong with me. Then they finally tested the blood in my catheter and said I had a nasty bug in there. So yeah, if you ever have to get on dialysis, get that catheter out of your chest as soon as possible. There's a lot that goes into failure that doesn't get talked about. You also have to watch what you eat. Um, I have to watch how many tomatoes and potatoes I eat because your kidneys not filtering out that stuff, filtering out your toxins. Potatoes and tomatoes and other fruits have something called potassium. Oranges have something called potassium, and if that builds up in your system too much, you can die from that. You can cause cardiac arrest. This is some real talk right here. I'm not making this stuff up. This is stuff the dietitians tell you. I have to watch how much fluid I drink. If I have too much fluid on me, that also makes it harder on the body because your kidneys are not functioning the way they're supposed to. There's a lot that goes into this that doesn't get talked about in the Black Manosphere, but I'm talking about it today because I have kidney disease. There's a whole lot of other stuff I can go over, but for now, let's see. Uh, Copy. Anybody wants to come up and talk to me about this? There's the StreamYard link, and I will be right back. All right, I'm back. I was outside cutting grass, so. But yeah, kidney disease is nothing to play with, folks. There's a lot that goes into it, and it's a pain in the ass to deal with, but it's something I'm trying to go through right now. It's something I'm going through right now, and I just wanted to share and talk about it. Thank you, Shadow Overseer, for the Cash App. But yeah, one of the reasons I'm going over this is because I'm looking to get a kidney transplant, and I have to go for a stress test tomorrow. So I thought this would be a good time for me to go over. I have to get a stress test so they can make sure my body's prepared to get a kidney. Um, y'all just give me. I'm just a little tired, but yeah, Sorry, I'm drawing a blank right now, y'all. Yeah, I just wanted to go over what it's like to have kidney disease and what are some of the symptoms. Uh, Looks like nobody wants to come up. That's fine. I probably won't do a live stream tomorrow because this stress test is an all-day event. But I would like to thank everybody that came. I'd like to thank everybody who donates. This is AB Media 83, and I'm out. Peace. Y'all have a great rest of your day. Yo, this is AB Media 83. Want to support the channel? Hit the Cash App. Also, be sure to like, share, and subscribe to the video. Also, be sure to hit that bell notification so you can be notified the next time I upload a live stream or video. And always remember, keep it grinding, keep it pushing, keep it moving. This is AB Media 83, and I'm out. Peace.